This video will review for both students and residents the PHM 4th year elective rotation. Fourth year students rotating through PHM are completing an elective rotation. However, the rotation provides autonomy similar to a sub-internship to maximize learning. Some of the fourth year students may be from Baylor, while others may be visiting students that are interested in learning more about our program. Fourth year students will follow a schedule similar to interns. They are expected to be at checkout at 6:30 in the morning and expected to be on time. They should communicate with their upper level resident if they will be absent due to illness, in addition to emailing the rotation director. Morning checkout occurs in the 6th floor resident area. Students should stay until 5 p.m. or until dismissed by the resident team when day tasks are complete. Students will also complete late stays with an upper level resident about once per week. They will complete 1 week of night float from Sunday to Thursday and will be off on the weekends and any Baylor holidays. The only weekend shift fourth year students will have is the first Sunday to start night float. Fourth year students will follow a similar didactic schedule to the residents. They should be present and participating in morning report and daily noon conferences. They should also attend all grand rounds and Janus rounds. Orienting new medical students primarily will be the responsibility of the upper level resident. However, all members of the team should assist as needed. This would be some of the basic items to cover on the first day. Fourth year students should see patients independently of interns. They should aim to see 4 to 6 patients each morning. This may vary depending on patient census and complexity. Upper level residents are responsible for reviewing with the student pertinent aspects of the patient case in preparation of family-centered rounds. They are responsible for reviewing the student's exam and note prior to rounds, as well as writing the progress note for the patients, followed by the fourth year medical students. When checking in for the rotation, students will be issued a pager. Often medical students feel out of the loop on patients when updates are given to the residents on the team. Using the pager will help with this. It may be helpful to provide the pager number to nurses and other staff when you want to be notified of something, such as when a consultant has visited or when a patient has completed an albuterol treatment. Students, please be responsible with these. You must return the pager by the end of the rotation when you return your badge. Fourth year students can hold the team pager and return pages once they become more comfortable with the rotation. This is an excellent opportunity to learn how to triage pages and how to cross-cover the team. Students should keep their upper level resident closely updated on pages. At the Children's Hospital of San Antonio, we conduct family-centered rounds, which is often a new concept to students. Refer to the family-centered rounds video for guidance on presentation expectations. Remember, you are having a conversation with the parents, which means no medical jargon. Think about alternatives like saying low sugar instead of hypoglycemia or as needed instead of PRN. With this in mind, summarize overnight events, what you saw in exam, any pertinent study results, your assessment, and your plan for the day. After rounds, students should complete SOAP notes on blue progress sheets. Alternatively, they may type notes in a Word document and save it to the student folder in the PHM folder of the S drive. Regardless of the format the student chooses, these notes should not enter the patient chart and should be reviewed daily for feedback. Reviewing notes should primarily be the responsibility of the upper level resident on the team, but may also be completed by the intern or attending if the upper level is unavailable, for example, if he or she is in clinic. In addition to notes, students should continue to manage their patients in the afternoon and should assist the team. This may include reevaluating their patients, following up on labs and studies, and communicating with consultants. Students should communicate with their team frequently with any updates. They are usually the first member of the team available to see new admissions. After seeing a new admission, students should discuss the patient with the green upper level resident or their team upper level resident. The upper level resident and the student should then see the patient together. The upper level will be responsible for completing orders and notes in Meditech. Fourth-year students should be encouraged to update the sign-out list on their patients, just as interns do. Students should also sign out their own patients to the night team in iPass format. These tasks allow the student to learn how to concisely communicate necessary information. Several nurses and ancillary staff may be able to assist with translating if they are available. However, be mindful that they may have patient care obligations that take priority. You may also use phone translation services placed on speakerphone. This phone number, along with the institution code, can be obtained from a unit secretary. Make note of these and keep this information handy on PHM. Pediatric patients should not be used as translators. Family and friends in the room may be able to assist, but be cautious as errors in translation or difficulty with medical terms may arise. The safest and recommended option would be to use a staff or phone translator. Students are encouraged to perform basic clinical procedures on pediatrics, including blood draws and IV insertions, NG tube placements, and catheter placements. When available, students may also attempt lumbar punctures. However, typically interns will have priority on these in order to become proficient. Students are encouraged to proactively seek opportunities by communicating with the resident team and with nurses. Communication and feedback are essential parts of student growth and development. Upper-level residents should give students feedback about their performance at the end of the rotation, at the very least. However, feedback throughout the rotation is encouraged. Upper-level residents should notify their attending with any major concerns.